in particular today, I asked you to come back and talk about a subject that people have been talking about a lot lately, pica.
Absolutely.
So talk to us about pica, what pica is, and some studies that you've been involved in so that we know more about pica.
Okay, so pica is a pretty serious behavioral disorder, and it involves eating or ingesting inedible objects. So, more mild forms of pica that you'll see are things like maybe, wood chips or tree bark or, scraps of paper off the floor. It's probably not healthy, but it's probably not going to kill the kid. But there's much more serious forms of pica that can make a child sick and or actually kill you. And so there are, kids eating lead paint in old homes. That's extremely toxic, extremely poisonous. Worked with a kid once who ate a dead bird, roadkill. And then in the really most extreme forms, I've actually worked with individuals who have eaten things like batteries, car keys. One man that I worked with actually ate a pair of scissors, a necklace.
Wow.
Yeah, it's very, very serious business. And eventually, if left untreated, that will kill you. Eventually, if you continue eating things like that, it's going to be the end of you. So it's very, very serious business.
And about how often do we see this in the autism community? Is it something that's common or uncommon?
Yeah, it's fairly common. I don't remember the exact prevalence off the top of my head, but it is fairly common in folks with autism and other developmental disabilities. It's not something that every individual engages in, but if you have a group of 30 kids, one of them's probably doing it, at least. So there's, if you have a child on the spectrum, there's a decent chance that at some point they're going to pick up something they shouldn't, put it in their mouth. So it's something to look out for.
And what's the difference between a child who's having natural curiosity and mouthing things and swallowing them, and actual pica? How would we recognize the difference between those two things?
That's a great question. The easy answer is you'll know it. If your kid has it, you'll know it. It's something that's much more persistent. It's ongoing. Sort of the normal or sort of typical way that individuals sort of explore things orally is, they'll try something out, it won't taste good, and they'll stop doing it themselves, or their mom will yell at them once and they'll stop, or their dad will slap their hand or something like that, and they'll stop. But if the behavior persists, even after you've kind of done the normal ways of discouraging it, then that's where it's something to be concerned about. And people with real, severe pica, they're eating edible objects every day.
Okay. And I've heard people talk about it being a compulsion. So, is it that there's something lacking in the diet, so there's a specific kind of thing that they're wanting to eat, or is it something that's happening internally that we're, not able to know?
Yeah, it's a great question. There's actually a variety of causes. We don't know all of them. There is a very small percentage of folks who are missing a specific mineral that they actually are, that's contributing to their pica.
Okay.
So I think there actually are 1 or 2 published cases where purely through vitamin and mineral supplementation they eliminated pica. And I'm forgetting off the top of my head whether it was iron or magnesium or it was some basic mineral. Just through supplementation the kids stopped eating inedible objects. However, that's very rare. That's not, I mean, it couldn't hurt to try that first because it's the least intrusive thing. Just give your kid a multivitamin, and that'll fix it. Then you can take your child to the pediatrician and have blood work done just to check for vitamin and mineral deficiencies. So that's something you could check for first. I would venture to say that's probably less than 1% of people with pica.
Okay.
So it's not, that's probably not what's going on.
But as a parent, is this ever something that we just want to wait and see what happens with pica and hope that they outgrow it, or is serious enough that we need to address it fairly quickly?
My general advice with any kind of challenging behavior is wait and see usually doesn't make the behavior go away.
Right.
We don't want to be sounding the alarm on every single little thing our kids do, but if it's a fairly serious behavior, and pica definitely is, and it's happened more than a few times, and it doesn't seem to be going away, so, he did it this week, he did it last week, now next week he does it again. If it's not decreasing, it's definitely something to be concerned about, and folks with developmental disabilities and autism in general, the general rule is they don't just grow out of challenging behavior.
Right.
The behavior is there for a reason, and so it needs to be addressed.
Okay, so what can we do about pica? What research has been done, and what can we glean from that research?
Sure. Well, the first thing to do with any challenging behavior, and I know you've talked about this a lot on your show, is a functional behavioral assessment, or functional assessment, or functional analysis. They all sort of mean the same thing.
Okay.
And they all involve figuring out the reason why the behavior is occurring. So the function of the behavior, or the source of reinforcement for the behavior.
Okay. And with pica, are there lots of different things, or is it usually, we talk about the 4 usual suspects for challenging behavior. Is it the same for pica, or is it really usually one of the 4?
Well, you always want to investigate all 4.
Okay.
And when you think about it, what is the most natural consequence that a kid is going to get when he puts something inappropriate in his mouth?
Well, you definitely would get attention if somebody's there to see it.
Yeah, for sure. So that's something to be thinking about. However, the vast majority of research that I'm aware of has shown that it's usually automatically reinforced.
Okay, that's what I was afraid of, because that's the hardest one to address. For me, anyway, I look at it and go, what do we do then? Okay.
It's the hardest one.
Okay, so once you've done the FBA and you've determined that it's not attention-driven, that it is self-reinforcing, what do you do then?
Right. Well, there's a few very specific forms of pica, specific forms of automatic reinforcement. One of them is actually nicotine addiction. And this one will be pretty clear to you. If your child or family member or whoever is eating cigarette butts, it's probably not a coincidence. It's not just any old inedible item. There's actually documented cases of nicotine addiction because of eating cigarette butts. And so once the person gets addicted, then they're going to be on the lookout, for cigarette butts. And that can be very toxic as well. There's all sorts of toxic stuff in cigarettes in addition to nicotine, so that's very unhealthy. Luckily now, especially in California, not very many people smoke anymore, so you don't see as many cigarette butts laying out around on the sidewalk and in the park and stuff, but still, it can be very serious. So if your child's eating cigarette butts, the first thought probably is this could actually be nicotine addiction. That's possible. But if it's just sort of general automatic reinforcement, probably what's going on is some form of oral stimulation. So there's something, basically it feels good to have something in your mouth is the source of reinforcement potentially. And so the treatments that have been shown to work generally, the first thing you always want to do is start with positive reinforcement. So basically, give the kid lots of reinforcement when he isn't ingesting inedible items. And specifically teach and reinforce other leisure skills, so other things to do with the child's time, essentially. So appropriate play skills, anything like that. However, at the end of the day, I think most of the research has shown the two probably the most likely to be effective treatment components are blocking, what's called response blocking, which is very, very difficult to implement, and it literally means following the person around constantly, and every single time they reach for an item, an inedible object, you literally physically block them. You don't restrain them, you don't hold them, you just block their intent. And they might immediately go for it again, and you block it again. Go for it again, block it again. I've done research on response blocking, and it's very challenging to implement. You literally have to follow the person around. So at first, this might be the type of thing where you need full-on constant attention from a parent or a one-to-one aide or something like that. And if it's serious pica, it's probably worth that effort and that amount of supervision to block the behavior.
But I would imagine that consistency becomes the hugest part, which means that, taking a drink, answering a phone, using a restroom, all of those things are going to be potential pitfalls.
That's right. That's right.
Wow. Okay. So what else is in the arsenal besides response blocking?
Right. So you probably want to do response blocking, but that's never enough in itself for any behavioral intervention. You always want to add in other components that focus more on replacement behaviors. So when in doubt, or well, I guess I should say when all else fails, a replacement behavior that's pretty likely to work for pica, for automatically reinforced pica, is just something else in the mouth that's more appropriate. So, there's research showing, just giving kids free access to snacks decreases pica. Well, that's kind of obvious, So let's say popcorn or celery or something like that gives the child something else to do with their mouth, makes them less likely to then bend down and try to pick up an inedible object. However,
gives
you can't
them that
just
chewing.
Yeah, it gives them an alternative behavior that produces a similar type of reinforcement, oral stimulation. However, you can't just eat constantly all day, right? So there's limitations to that. There are some other options that don't look very socially appropriate, but just sort of other things to put in your mouth, like chew toys, teethers, parents complain that it looks like a dog toy, that it kind of, and that's true to some extent, and so that's probably not your first line treatment, maybe not your first option to give a mouthing toy. But at the same time, if it's a choice between, having your child chew on a teether versus having your child eat rocks off the ground that are, toxic, it's a pretty obvious choice.
Right. And there are some cooler things that are out there that are mouth stimulation things that we got for my son. There was a necklace that they have for even college kids. That it kind of looks like a yin and yang, and it's on a really organic ribbon and everything, so you can even put the ribbon in. And all the kids in school thought it was a really cool thing. So he only had it for a short period of time, and they faded it out. But pica was not his issue, but he was just needing to chew, teeth cutting and stuff.
And there's some that have other functions built in, like teethers that vibrate when you bite on it, so it provides even more stimulation. And
they come with different, like you can get even to the point where you can buy seasonal little toppers on them that vibrate. So if it's spring, they have the spring set of vibrate things to stick on. They look like little pencil tops. And holiday ones. It can get very expensive. You don't need to have all those, but they do make them to make it a little bit more reinforcing to the child to use it. Okay, so, but when we implement these kinds of things, when we give them the choice of other things, they're more likely to decrease the pica, as well as the response blocking. And that basically what's in our arsenal, or is there anything else that we can be doing for pica?
That's pretty much it. I mean, that's what the research has shown to work. And there's other more intrusive punishment procedures, but we're not going to go into those. And that's that's really not your first line treatment. You need really, if your child has pica, significant pica, you need a qualified person who's an expert in treating severe behavior. You really need a BCBA or a behavior analyst with a lot of experience with severe behavior. It's probably not the kind of thing you're going to fix on your own, especially if it's automatically reinforced. It's pretty tough. You need someone with professional, top-level experience.
Okay. And really important to find the function of the behavior. This is going to sound like a strange segue, but we just adopted a dog, and
congratulations, I think.
No, not in this circumstance, not at all. And the dog is engaging in a lot of challenging behavior. And we're asking, I said, let's get experts in, because I don't know what this behavior is, and so let's get experts in. And the experts are saying that it's too aggressive. They can't even work with the dog. So, yes, I know it's difficult. But not even one of the challenging behaviors that we're specifically worried about. The dog, she's about 18 months old, but she's trying to eat our couch a little bit at a time. Yes, exactly. And this is what made me think about this, is that we're seeing that it doesn't happen sometimes, and so I'm kind of doing my own little FBA on why is the dog eating, and when does she eat, and how many hours can we be gone before she eats, and what toys can we leave there that she chooses those over the. Very interesting to me. But I started thinking about it in terms of pica, and when we come back after the break, I'm going to talk to you about some studies that you've done with pets and our children, getting our children to appropriately interact with pets. So there's my segue.
All right.
From the pica to the animals. We're going to take a break. When we come back, we are going to talk about having a pet in your home and how you can be working with your child to have that be a positive interaction. So stick with us. More with Dr. Jonathan Tarbox when we come back. Welcome back to Autism Live. Our special guest right now is Dr. Jonathan Tarbox. It's Friday. It's the 11 o'clock hour on Friday. We're always thrilled to have him here. He's such a wonderful resource. And I said that when we came back from break, I wanted to talk about pets.
Okay.
Because we know that having a pet has the potential, at least, to be a positive experience for a lot of our kids.
That's right. Yeah. And actually, there's a decent amount of research that shows that owning pets contributes to a lot of sort of quality of life outcomes. So increases in happiness, decreases in stress, just sort of overall life is better with pets. Not to say that it's a substitute for effective treatment for depression or something like that. That's not that.
No.
But just overall, there is associated positive outcomes. And actually, there's research showing that I don't know if I totally buy this, but it's interesting that the overall costs of owning a pet are actually less than the overall costs of medical expenses that
Really?
decrease because of owning a pet. Yeah, so
This
it
would
actually
not be
is
true in our
cost-effective.
case right now. But nice to know that that's a possibility when it's working right. I would also think that there's a social element to it for our kids, that whenever anybody to my child's school, brings a pet to the gate,
That's
that
right.
child becomes the rock star for the moment.
That's right. So it can be a major conversation piece. It's something that will allow your child to stand out that other in a positive way,
Yes.
and that be focus of attention for other kids and something to basically talk about. So
Exactly.
an easy way to get into that social
Right.
sort of social dance.
Icebreaker.
A lot of an icebreaker. Yeah.
I'm hearing all these things. We just adopted a pet, and none of these things are working out because our pet has imprinted on the three of us, my husband and my child and I, and loves us and is fine with us. Anybody else walks by and the dog turns into Cujo.
Oh, man.
We're trying to figure that out. She's had a traumatic past, but in any case. But I'm really particularly interested in, you guys did a study about when you have a pet, because sometimes our kids, they engage in challenging behaviors and that can transfer to the pet.
That's right.
And you're having a non-productive relationship with the pet. And you had a particular study that you did that for me was very eye-opening. So tell us about how the study came about, what it was, and what you discovered.
Sure. Well, as you say, a lot of the kids that we work with and kids in our families can have sort of challenging interactions with pets. Kids could become aggressive with pets for sort of the standard reasons that we normally think about, like it produces attention, it gets a big reaction out of parents. It could be actually just due to the reaction of the pet. So occasionally the pet is just in the kid's face too much and wanting too much attention. And so if the kid kicks it or pinches it or throws it, that'll produce the response that the kid wants, which is leave me alone, right? And other times too, maybe it's just the sort of magnitude of the response. So if the pet jumps up and runs away, that could be kind of funny to a kid, and not just kids on the spectrum, but frankly any kid.
Yeah.
So yeah, we do see this from time to time, and it was something we were interested in addressing. And so actually, we did have a family that asked us for help with this in particular. So we took a look at the behavior. We did a functional behavioral assessment, and what it determined was that there were basically two reactions that the kid was getting for his aggressive behavior towards the dog. And one was attention from parents, which makes sense. That parents were having a big reaction. Don't hit Fido. How many times have I told you not to do that?
Exactly.
The parents are afraid of the dog getting hurt, but of course the parents are afraid of the dog biting the kid if the kid continues to do it, right? And in this case, actually, that had happened. The dog had bit the child in the face. Luckily, didn't produce any real serious damage, but still, there was potential for it escalating and becoming much more serious.
Right.
And so one sort of source of reinforcement for the kid's behavior was attention from parents.
Right.
But then the other one was just merely the dog's reaction. And so what the child did was, when he was aggressive with the dog would yelp, jump up in the air, and run away. And it kind of looked like a cartoon. It was funny to the kid, essentially. And I don't mean to sound callous, but it was kind of funny to the kid. The dog had a very large reaction.
Right.
And so there were sort of two sources of reinforcement there. So the first thing that we dealt with was, we thought, and this is the standard approach, this should always be your first line treatment in any challenging behavior, is no longer provide reinforcement for the challenging behavior.
Right.
It's called extinction, right?
Exactly.
But then also teach and reinforce an alternative behavior that's more appropriate. So in this case, what we wanted to do was teach the child to pet the dog appropriately and increase that behavior, because we thought, well, that's a nice way for them to interact, right? And if the kid's busy petting the dog appropriately, then perhaps he won't be engaging in the aggression towards the dog.
Right.
So we tried that first, and what happened was we increased appropriate petting a lot, but then the kid would also aggress towards the dog.
Right.
And so it didn't actually decrease the challenging behavior.
It didn't become a replacement.
It really didn't become a replacement.
It just hand in hand.
Sort of a supplement, yeah.
Okay.
And so the kid would sort of pet the dog with one hand and attack the dog with the other.
Okay.
Yeah, and so that way he was able to earn his reinforcer, but also still get away with the behavior. And the dog would continue, and of course the parents would no longer pay attention to it. They were doing extinction, which was great.
Right.
But the dog wasn't doing extinction, because when the kid would attack it, the dog would of course yelp and run away. You can't blame it.
Sure.
Right.
And we can't control the dog.
No, yeah.
So we got to look for other things,
yeah,
right?
we can't tell the dog to engage in extinction.
Could you please ignore that behavior? Could you put that on
just let the kid
ignoring?
hit you. Don't worry.
Not going to work.
No, it's not
but
gonna work.
that's real life. We have that when our child does something to another child. We can't say to another little child, you can't react to that either.
Absolutely not. And frankly, most parents are not going to be okay with just letting a kid hit them,
Right.
Yeah.
Right.
So then the next thing we did was we said, well, okay, clearly what needs to happen is the kid can only earn the reinforcer if he does not engage in the challenging behavior.
Right.
So we did what's called a DRO, or differential reinforcement of other behavior, and that's sort of a fancy sounding term, but all it means is giving a reward or a reinforcer for the absence of the behavior.
Right.
So basically it's teaching the child to refrain from the behavior or inhibit a behavior.
Right.
It's reinforcing omission of the behavior.
Right.
So we started with a very short duration of time, 10 seconds I think we actually started with.
Because that's really the key with that, right? Is that you got to set the time of when you're going to deliver a schedule.
That's right. And so what we wanted to do was make it so that the kid could earn the reinforcer if he didn't attack the dog, and he only had to wait 10 seconds. Or he could try to attack the dog, we'd still block it, but he wouldn't earn the reinforcer. So it's a real simple choice here. So the only way, and he could still pet the dog nicely, and that's great, but you're not getting any reinforcers unless you refrain from attacking the dog.
Okay.
So what we did was we started out with 10 seconds, and it looked kind of ridiculous, right? And we had to be right on top of him. Okay, just wait 10 seconds, and then you get whatever the reinforcer was. Oh, and by the way, each day that we practiced this with him, we did a preference assessment to determine what reinforcer he wanted to work for. And so we usually just give him a choice between 3 or 4 different things.
Okay.
He'd pick one, and then that's the reward he would work for during that session.
Okay.
And so it could be an M&M, it could be some free time on the computer, it could be a Game Boy for a minute or two, but some small but meaningful reward.
Meaningful to that individual child.
To him, yeah, exactly. And so it wasn't what we wanted him to earn or what we thought would be appropriate, is what he actually chose.
Right.
And each day was something different, and that's fine.
Yeah.
And so we started with 10 seconds, and what we would do is gradually increase the time if and when he was able to refrain from attacking the dog.
Okay.
And what we did was we gradually faded it up to 10 minutes. And so it got to the point where we'd tell him, okay, as long as you're cool with the dog for the next 10 minutes, you get X, Y, and Z.
Right.
And it was no problem. It faded it up to 10 minutes. And then at that point, we said, okay, we asked the parents, well, let's, it's time to train you. Let's have you do it now, right?
Right.
And they said, well, okay. And it turned out, actually, he had already generalized the behavior. And so he wasn't attacking the dog even when we weren't there anymore. And so it was a real nice outcome.
And key to that, though, starting with that small amount, I think.
Yeah.
How did you arrive at 10 seconds?
10 seconds? Well, there's a couple different ways to decide where you want to start with your, we call it the interval, the DRO interval, which is just the duration of time the kid has to wait before getting the reinforcer, as long as they're not doing the challenging behavior.
We talk all the time about jargon, and I have to remember when I'm making fun of it, the DRO interval.
DRO interval.
I don't know about you, but my eyes start to glaze over. I go,
Yeah,
what?
right. Huh?
But remembering that we're going to reinforce for the absence of the behavior on a regular schedule.
Yeah, it just means don't do the behavior for this amount of time.
And then you get this.
And then you get the reinforcer.
Okay.
Yeah, okay.
Okay.
So a couple different ways of doing that. A really good way to do it is to actually collect data on the behavior to see how often the behavior happens when the DRO is not in place. And so what you're looking for is, well, on average, does the kid have the behavior every minute? Does he do it once every 10 minutes? Is he doing it 2 or 3 times a minute? And you want to set the DRO interval, or the amount of time the kid has to go without the behavior, shorter than the shortest amount of time that the kid normally doesn't do the behavior for anyways.
And you make it shorter so that you ensure that you've got success.
That's right. That's exactly right. And so the way ABA works is you're basically just overwhelming the child's environment with consequences that make the positive choice easy. So you're just stacking the deck against bad behavior, stacking the deck in favor of good behavior. So the kid could still hit the dog, but why would he do that when all he had to do was wait 10 seconds and not hit the dog, right? So he made the choice really easy for the kid. And then the reason why ABA works is you use these powerful rewards with really easy choices, and then gradually increase the demands or increase the requirements, and you do it so slowly that you're still making it a very easy choice for the the kid to have good behavior. So if he can wait 10 seconds, why not wait 12 seconds?
Right.
And I think that was the next step, or maybe it was 15 seconds.
Right.
If he can wait 15 seconds, why not wait 20 seconds, right? And basically what you're doing is getting the individual used to engaging in those good behaviors for that period of time. And we gradually increased it to 10 minutes, and it worked great, but you do have to be slow and you have to be systematic.
And if at any point, let's say you had increased it to 20 seconds and the child engaged in the behavior, first of all, you made sure that they didn't get the reinforcement, but would you go back to 18?
Yeah, absolutely. Yeah, and so that's common. You oftentimes you find that you increase the requirements a little too much, so you have to step back. And that's not a big deal. It doesn't mean it's not working. It just means you have to step back. You increased it a little too fast. That's very common. And then what you want to do, though, is decrease the requirements and then look for the behavior to get good again, and look for that to be stable. And then once that's stable, then gradually increase again.
It's like prompting.
Yeah, exactly like prompting.
Okay, so what's really striking to me about all this is, first of all, I'm fascinated because I think of you guys as knowing everything about ABA and that you're just going to be able, you're like your machines and you can spit out what the response is. And when I hear you talk about the process, what I learn is that you guys are constantly making adjustments just like we have to.
That's exactly right. And you know, the problem with, or a major problem, not the problem, but a major problem in autism treatment is everyone's sort of looking for a magic pill, or everyone's sort of looking for a be-all, end-all, or everyone's looking for a cookbook, you know, or a recipe. Oh, you want to fix your kid? Follow these 3 steps. It's not like that. You know, behavior change in any way, and whether it's you want to learn something, whether you want to increase your exercise or learn a new musical instrument or learn a new language, it doesn't just happen overnight. Behavior change always happens gradually, and if you want to be effective in changing behavior with yourself, with your child, with anyone, you have to be kind of an artist. You have to be sensitive to ongoing changes. You have to be thoughtful. You have to plan ahead, and you have to respond to changes. So if your kid's doing really well, great, up the requirements. If he's having a tough time, that's fine. Stay there for a while or step back a little bit, but you have to be sensitive. It's a puzzle that you're constantly solving. It's not a recipe that you're following.
Which is amazing to me. And what that does for me as a parent is it gives me license to not always have the answer. Oh, yeah. Because I always think that I'm supposed to have the answer.
Yeah, of course. We always do as parents.
Yeah, exactly. But it's really remarkable, and the fact that you guys never give up, that you know the answer is there. And our kids are smart. The fact that, you know, initially when you said, okay, well, we're going to reinforce the good behavior and hopefully that'll get at it.
Yeah, and we sure thought it would work. We're sure that's the standard treatment. It always works, right? Well, not in that case.
Except that the child was so smart that he's figuring out how he's going to get his reinforcement and have his cake and eat it too. And our kids are smart. That's not a bad thing.
It's a great thing.
Sometimes they're smarter than us, but I love that, you know, then we have to figure it out. That's fascinating.